Are you a medical provider who works in the birthing space? Are you so tired of hearing people say that they have birth trauma? Big surprise! Birth trauma doesn't just mean I had a cord prolapse, I had an emergency C-section. Birth trauma can mean no one listened to me. So that's why today I'm going to teach you how to prevent 95% of birth trauma from a provider standpoint. Let's start with our first interactions with our patients. Sit your butt down if they are sitting. Lean in. Before you start asking admission questions or medical stuff, ask them about them. People don't care how much you know until they know how much you care. And before you transition from learning about that patient to learning about their medical history, I want you to insert a conversation. I am your advocate. I am here to listen to the things that are important to you and echo them louder to the people that are also in our care team. I am here to protect your autonomy. I'm here to be your tour guide of birth. I live here, I work here, I know the good restaurants, I know the places to avoid, but you are the driver. If I see anything on the horizon that could be a possibility, I want to talk to you about that before it happens so that if it does happen, it's not as scary. That conversation that you have is not just words. I want you to appreciate the fact that even though you are in these spaces every day, your patient is not. And the things that aren't scary to us could be scary to our patients. Always assume that this patient is coming in with a traumatic past and act accordingly. Those are promises that need to be kept. If something is going sideways, I want you to look in that patient's eyes and tell them, I've got you. If the patient's coming in a pretty relaxed state, talk to them right then and there about all of their options for pain control, the good, the bad, the ugly. It's so much easier to make decisions when you've already had the information given to you rather than if you have the information given to you while you're in pain. Seek out opportunities to provide your patient with comfort, movement, and support. Get creative. Give your patients like a menu of birthing positions to try. Bundle birth has a great one. If your patient is wanting to do something or decline something that you think may put them at risk or put their baby at risk, do not tell them that you know better than them and they're being dumb. Ask them about their decision. Sometimes those decisions are super informed and they know exactly what they're talking about. And sometimes they're based on something they saw online that's not true. Educate from a place of compassion and love, understanding that there is not one person who comes into the hospital who doesn't want the best for their child. We all go about that different ways. I am so tired of hearing about birth trauma because it is so preventable, even if things go sideways.